So the first story I want to tell you is about my mom, who passed away last summer. And when she passed away, she was 86. And 25 years ago had been hospitalized for diverticulitis. She had had a section of her colon removed. And she, at that time, was already on Medicare. My dad's a retired federal employee, so they had very good coverage. And 2.5 years ago, she went to the emergency room and she thought what was a severe flu and was diagnosed with stage 4 colon cancer. Now, my mom is mixed race, as am I, and I know for a fact that if the doctor says come back in 90 days, my mother does not leave her doctor's office without making an appointment. Has been like that her whole life. She is of a generation that believes doctors know best. And they will tell me if I have to come back, and they will tell me if there's something wrong. So I get a phone call from the emergency room in Southern California that my mom's in the emergency room and they've just diagnosed her with stage 4 colon cancer. And I said, how did they do the diagnosis? Well, they tried to do a colonoscopy. They couldn't finish the test. And the emergency room physicians are stunned because at the age of 84, my mom has had her first colonoscopy. And so for me, being from a health policy perspective and knowing about evidence and what should be happening, I am outraged here in Portland that from the time that she'd had a colon resection over a period of 25 years, my mother had never had a colonoscopy. Seeing the same primary care provider. And what I know happens is that she would go into the doctors and she probably would say, you know, every once in a while my stomach feels a little queasy and I think it's a milk allergy and I think it's this and I think it's that. And the doctor would say, do you want us to check it? And she would respond, do you think it should be checked? And what that doctor saw was a delightful brown-skinned woman in front of him who had no other health conditions. And he'd say, you know, we could do a colonoscopy, but it'll be uncomfortable. Do you want to have it? And she would say, do you think I should have it? And it never happened. Now, my father, same primary care provider, had been diagnosed with prostate cancer a year or so before, also goes to the doctor every time they tell him to, has had every test, every screening that could possibly happen, and my father is white. Now, the two of them would never believe anything happens to them differently because of the color of their skin. That is not in their belief system. For me, I know that it did. And it was an outrage to me that somebody who had good coverage, who had good care, went undiagnosed for a period of time when she could have been diagnosed much earlier. So this whole notion of what do physicians see, what assumptions, and I'm not bad-mouthing physicians, but I think it's just our system. So many decisions get made based on who walks in the door that if we do not require and expect good communication and what they can know and what they might not be told, there's a lot of work that we have to do at the front end to make that healthcare encounter be productive at the healthcare end. So my second story is about my daughter-in-law, who is from Busan in Korea, and she had a baby at Emmanuel Hospital 16 months ago, so I'm a fairly new grandma. And her mother came over from Busan for the delivery. So we're at Emmanuel. My daughter-in-law has spoken English for 3 years. And when she got to the hospital, we said, it would be so great if you would get an interpreter here in the room. And they said, but your daughter-in-law speaks English. We've been communicating with her. And I said, but her mother does not. And she can speak English, but the nuances get lost. Especially if you're in labor, it's kind of a scary time. So they said, don't worry, we'll call somebody. My daughter-in-law had an incredibly difficult delivery. Almost bled out in the surgical room. So imagine her mother, speaking no English, sitting in an empty room with us, where her daughter has been wheeled out, is gone for 6 hours, and we cannot communicate with her about what's going on, and the hospital said, we do not call interpreters for family members, only for patients. And all I could do was to go, I'm petrified. How much more petrified must this woman be not having a clue what has happened to her daughter. And it was criminal to me. So we have a system that says that interpreters are available by phone, we can call somebody, and we still have kind of a broken system that's got a lot of holes in it. And trust me, the folks at Legacy have heard from me about the interpreter stuff. So, but to me, it's at every encounter, it should be what's in the best interest of this patient walking in the door, and how do we make those things happen? If we were really going to end up with a healthcare system that's going to work for all of us, that has to be the starting point. Designing something that's about health, how do we make that work to get to that end? And when we talk about inequities and disparities, the reason that, I would echo Joanne's comments of just getting coverage for everybody isn't going to get us to a point of eliminating disparities, is that we're not all at the same starting point, number one. We're not all getting the same care when we walk in the door. And as much as I love this country, and I love Oregon, and I love Portland, we live in a society that really makes a lot of judgments on people based on what they look like, how much money does it look like you have, what type of things does it look like you're bringing in the door, how you communicate, how you're able to carry yourself. Lots of judgment decisions go on. Now, if I'm in a 7-Eleven, I might not care what the person at the counter thinks about me.
That's right.
If I am needing care, or someone in my family needs care, I want to know the person in front of me has been trained, knows how to communicate, and that is much more than translation. And that we just have a system that is designed to actually take care of the person that's in front of them. And I think we have a lot of work ahead of us in trying to get that done.